Hi, my name is Katie Lawrence, and today I will be presenting on the major public health issue, which is obesity. And I will be comparing between the US and Japan. I chose these two countries because they represent completely opposite ends of the obesity scale. The United States has one of the highest obesity rates among nations, while Japan consistently has had one of the lowest. In this presentation, I'll explain what obesity is, review national level data, and explore the social, cultural, environmental, and policy factors that contribute to these differences. I will also discuss what the US might learn from Japan's approach. So why compare these two countries? The reason is because US and Japan show dramatically different patterns. The United States ranks near the top among all countries in adult obesity, while Japan ranks at the very bottom. So let's start off by defining obesity. What even is it? Obesity is defined by the World Health Organization as having a body mass index of 30 or higher. Adults with a BMI of 25 to 29.9 are considered overweight, while a BMI of 30 or higher is classified as obese. Obesity is linked to diabetes, heart disease, and stroke. Because of these health risks, understanding why obesity rates differ dramatically across countries is important for improving public health outcomes. Looking at it in a global context, obesity is a global issue affecting over 1 billion people worldwide. Rates are rising rapidly in industrialized nations, creating a significant public health burden and increased healthcare costs. So now let's dive into a little bit of data. In the US, about 42% of adults are classified as obese, with rates rising steadily over the past 30 years. Childhood obesity is also increasing, particularly in low-income communities and areas with limited food access. Now, looking into Japan, by contrast, they have an adult obesity rate of only around 4%, which is one of the lowest among developed countries. Rates have remained stable for decades due to a strong national culture of health and preventative care. This is just a chart specifically emphasizing again how the US has around 40%, while Japan only has around 5%. So some major causes that cause obesity in the US are the fast food culture and large portion sizes, as well as how often adults are sitting around, whether that's in terms of at work or at home. They are also very car dependent when they're trying to get places, and they have higher levels of stress and sleep deprivation. Now, the reason why Japan's rates stay lower than the US is because their traditional diet is vegetables, seafood, and fermented foods. They also have way smaller portion sizes than the US. They get involved with high levels of daily walking, and they also have national health check systems that I'll dive into in a bit. When we compare the diets between the US and Japan, the typical US diet includes a lot of fast food and processed food consumption, very large portion sizes, high sugar intake, and limited vegetables and whole grains, which ultimately contribute to higher obesity rates. On the other hand, Japan's traditional diet emphasizes more vegetables, rice, fish, and fermented foods. As well as portion sizes are smaller, sugar intake is lower, and meals are more balanced, contributing to the population's low obesity rate. When we look at the lifestyle comparison, Americans tend to have very stationary jobs, like being in a cubicle from 9 to 5, and they rely on cars very often. Whereas Japanese cities are very walkable, people often use the public transit, and daily steps are much higher on average. Diving into the cultural influences, the cultural influence affects eating and activity habits. In the US, convenience and individual choice dominate, while in Japan, collective responsibility and social norms encourage maintaining a healthy weight. As for the environment, the built environment affects obesity in the US, where there are cities that often have food deserts and are car dependent, which ultimately limits access to healthy food and activity. As for Japan, the Japanese cities are very compact and walkable, providing better access to fresh foods and more movement during their daily lives. For the healthcare differences, the United States policy is mostly reactive rather than preventative. There are no national requirements for waistline or BMI monitoring. Nutrition labeling exists, but it's pretty inconsistent. School lunch reforms vary by the state, and food marketing is widespread and largely unrestricted. Japan, though, is extremely proactive in preventing obesity. In 2008, Japan passed the Metabo Law, which requires annual waistline and BMI screenings for adults aged 40 to 74. Those who are at risk are given lifestyle counseling. Japan also has food education known as shokuiku, which is taught in schools. Portion sizes are standardized and generally way smaller than the US's portions. The marketing of unhealthy foods to children is limited. This nationwide preventive strategy is unique and contributes to Japan's low obesity rates. Getting into the economic factors, for the United States, obesity costs around $173 billion annually, mostly in healthcare expenses. There is also a lost productivity from chronic diseases that adds billions of dollars more. Japan has lower obesity levels, which means lower national healthcare costs, and their preventative screenings cost money up front, but ultimately save resources in the long term because they reduce chronic disease rates. Looking at the policy differences, the US policy mainly focuses on treating obesity-related diseases rather than the prevention. Like I said, the programs vary by state and there are no nationwide nutrition or waistline mandates. However, Japan takes a more preventative approach. The Metabo Law mandates annual waistline screenings for adults, the workplace health programs are required, and schools typically follow a strict nutrition standard. In result of all this, the higher obesity rate in the US directly affects national health outcomes. Around 11% of the population in the United States has type 2 diabetes, and cardiovascular disease remains the leading cause of death. Japan's lower obesity is linked to the lower rates of chronic diseases. Japan also has the highest life expectancy in the world, at around 84 to 85 years. To sum it all up, the US obesity rate is 8 to 10 times higher than Japan's due to lifestyle, diet, and environment. Japan emphasizes prevention, while the US is more focused on treatment. So Japan maintains low obesity rates thanks to culture, policies, and environment, showing how prevention is key. I also wanted to just mention some lessons that could improve the US outcomes coming from what Japan has done. Number 1 is implement more preventative screenings to identify obesity early. 2, promote balanced portion-controlled meals through education and policy. 3, improve walkability and public transportation to encourage daily physical activity. 4, create stronger school nutrition programs nationwide, and 5, limit the marketing of unhealthy foods, especially to our children. By addressing these areas, the U.S. could make meaningful progress in reducing obesity rates. In conclusion, the comparison between the United States and Japan show how deeply public health is shaped by the social determinants of health. The U.S. faces high obesity rates due to a combination of lifestyle, built environment, and policy choices, while Japan's focus on prevention, diet, portion control, and active living helps maintain its low obesity rate. Understanding these differences helps public health professionals identify strategies that could improve national health outcomes overall. Here are my references, and thank you for listening.